Hi, I'm Heather Reddin and I'm one of the advanced clinical practitioners for Urgent Community Response, South Warwickshire University Foundation NHS Trust. So, a virtual ward could be described as an area where the patient stays in their own home when they would normally potentially have been escalated to a hospital environment, but giving them a choice. And also, so it's patient choice, it's patient experience, but it's also about necessity. So sometimes there are things that we can do in people's homes for the patients that they don't necessitate going into hospital for, and that sometimes is very positive. We have to be realistic about what we can do in people's homes, but there's not a lot we can't. It's just we have to have the resource, skills, knowledge and competence to do that. I go and visit patients who sometimes are in crisis, feeling incredibly unwell, wanting help on a healthcare basis, but sometimes on a social care basis as well. And overwhelmingly, I don't want to go to hospital. People are scared. People are anxious about all sorts of things. They've got some people have got dependents. Some people have got animals. Some people just don't want to go away from their home, and some people generally haven't been out of their homes for a long time.
My name's Dawn Adams and I'm 76 years old and I live in Long Itchington, a village near Leamington. Well, I was having a lot of pain in my knees and I went to phoned the GP about it. And we've tried different tablets and I was sent to the physio and for x-rays, and it was decided that I'd got arthritis in both knees. So the GP thought in the end the only remedy that would help me with pain was to give me a morphine patch. So my daughter fetched it on the Monday lunchtime, and by the Tuesday evening it was just driving me mad. I was just feeling so ill, I just ripped it off. Anyway, for 3 or 4 days I just couldn't get off the bed, I couldn't eat, I couldn't drink, I was really so ill. I was losing weight and it was that hot days when it was 40 degrees heat, so I was dehydrated as well. And anyway, I just didn't know what to do with myself. And anyway, when I got out of bed, I managed to come downstairs. I just laid on the settee. Anyway, on the following Monday, my daughter got in touch with, or she got in touch with my daughter, and to ask how the patch had gone. And she had to say, well, it's made Mum so ill that, we just don't know what to do with her. Anyway, she suggested I should go to hospital for blood tests. And I just shouted, I can't travel. I just felt too bad to travel. So she had an idea to get in touch with this team. Heather was the head of the team. So she phoned to say that they would send somebody out to take a blood test from my home, which was good. Anyway, within hours, he was out here, took a blood test, went back, and by 5:30 that night, she'd phoned my daughter again to say, I'm coming out to see your mum.
We were called through the single point of access to Pat. She had reported that she felt very nauseated, very sick, had got a reduction in appetite and had been losing weight for a little while, really, but it had got worse and her family were incredibly concerned. So in the first instance, I assessed all her background history. I used lots of different records that we've got. So our IT system, we're able to look on the GP IT system as well. I looked on the hospital records and any kind of history that I could get just to build a picture before we went to see Pat. At that point, I decided that it was probably good if I'd got a baseline set of bloods because there didn't seem to have been any bloods for a long time. So once the blood tests were ready, I went and reviewed Pat myself because obviously her sodium levels were very low. And I explained to her that, there was a problem. I think there was a degree of relief on Pat's part because in the first place, with just a set of obs and looking at her, you'd think there was nothing wrong. So, but she knew there was something wrong and had a few things like feeling sick and the weight loss. She was also worried about her knees and saying that she'd got an appointment coming up for the orthopaedic surgeons to list her for surgery, and she wanted that, but obviously felt so wretched. So I said that we'd review her again, and that was where the virtual ward came in. We discussed Pat's case on the virtual ward the next morning with the frailty consultant and made some agreements.
She said that the sodium level was low and to stop taking an indapamide tablet, which I have to take for blood pressure, and my naproxen, and to only drink a certain amount of water, which I did.
So 2 days later, we repeated her bloods. She knew where to phone if she was getting worse, so that we could go back and see her. And the sodium levels hadn't really changed, and that was a bit of a worry.
On the Sunday, she phoned Melanie to say that the thing was still low and I really needed to go to hospital. And I said, there's no way I can travel. I'm feeling better anyway. I'd started to eat. My daughter was going to even cook me a dinner, which I fancied mashed potatoes and gravy. And I just fancied it. So anything I fancied, like Melanie, I fancied a bacon sandwich one day. And what I fancied, they did for me and I could eat it. And then I started to feel a lot better.
So we then sort of made plans for going back and seeing her pretty much every day. And after, was it about 3 days, we did another set of bloods and her sodium levels were coming back. They weren't completely normal, but they were coming back on board by then, and they were coming back to normal. So we were really pleased about that. She was really pleased about that. And actually that showed, she said she didn't feel so sick. She was feeling a lot better.
So by the time Sunday dinner time came, I was feeling better and that, and I thought, oh God, I can't go. Anyway, she said, all right, like Melanie pleaded with her to not send me in. And they were very good. She said, well, I'll send one more lot out to take the blood from, the other home, which she did. And then by the Sunday night, she got the results and she said it has gone up. She has started to feel better. So we were, saying the right thing. So that's how it sort of happened and that. And then on the Sunday evening, she phoned to say, yeah, it's gone up and, we're not worried about it now, which was good. So
she then said that she'd got an orthopaedic appointment for the following week. So if her sodium levels had not come up, I was also in conversation with a frailty consultant to the same day she was going to go into the orthopaedic consultant, I was also going to get her a review in the frailty assessment area, because that would have saved her transport as well. When we found her sodium levels were really low, I did phone the GP just to keep them in the loop as well, because these patients are their patients as well, and explained that we'd stopped certain medications. And the GP was happy with that. Also added in another medication that needed stopping. So again, we've got that primary care and secondary care and us as community working all together for the benefit of the patient in this sort of virtual ward for this week. So after the weekend, she went in and saw the orthopaedic consultant and they listed her for surgery, which we were really pleased about. I followed her up since in terms of GP notes and things to see what's happened, and her sodium's completely normal now. They've changed some of the medications completely because that might well have been the problem in the first place. And she's waiting for her knee replacement now, which I'm really pleased about.
Yeah, I preferred being at home for them to come out to me, because I just felt so much better, at ease. I could eat when I wanted, have what I wanted cooked for me most of the time. And it was just easier and better, and the team were lovely. I mean, when they came out, they were efficient and polite, and yeah, so I think I was better at home than I would have been going into hospital. Heather Redding, who I believe is over the team and that, she was amazing. I mean, she was lovely. She couldn't have done any more for me. I mean, to phone me at home over things, you know, and to send the two men out, like, that took the blood and that. I mean, they were lovely. They couldn't have done any better. They were so nice to me. And it made me feel, you know, like a person then, you know, yeah. So I can't fault them for the service I got from them. Being as I'd never even heard of the team before, yeah, I think they were amazing.